Hello, this is Dr. Gay from First Look MRI, and this is a 14-year-old cheerleader who fell recently, and the orthopedic surgeon was worried about an injury to the ligaments of the thumb, and so they ordered an MRI. And in this view, just to get some anatomy, we have the thumb, we have the this is the first metacarpal bone rather. This is the metacarpal head, and we have the proximal and distal phalanges of the thumb. And so the main thing we're worried about is this joint. This is the first metacarpal phalangeal joint, the first MCP joint, and there are some important ligamentous stabilizers. Right over here we have the ulnar collateral ligament, the UCL. It's like a little cable that attaches from the metacarpal head to the base of the proximal phalanx. This looks good. This is torn when the thumb is stretched outwards. Sometimes people will catch a ball, or their thumb will get hung on something and they'll stretch it outwards, or ski pole. Sometimes the ski pole will pull it downwards, a pretty common injury, and then we'll tear the ulnar collateral ligament, the UCL here, that's closest to the body. Another ligament out here that's less commonly injured is the radial collateral ligament, right over here. And in this view, we don't see the ligaments as well as on this view. This is with fat suppression, and now we get a little better shot at these. But this is the UCL, ulnar collateral ligament. We see it clearly coming off the first metacarpal head. It comes up, up, up. And at the base here, we don't see it quite as well, but it looks like it is intact there. This one, we don't see it as well, but definitely not torn. So the UCL, or ulnar collateral ligament, is intact. Now on the opposite side, the radial collateral ligament, we see this dark band here. Instead of being long and narrow and uniform, it looks more globular. We see it attached to the base of the thumb here, the proximal phalanx, but we don't see it attached very well to the first metacarpal head. So it looks like this is a tear. Let me zoom this on up here, involving the attachment right here. So this is the base of the thumb. This is the ligament that's kind of balled up on itself a little bit thick, and there's a little space here that's bright, and this is where this ligament is pulled off from the periosteal attachment to the bone and lifted up. And so we call this a tear of the radial collateral ligament from the attachment here in the first metacarpal head. And when this tears, the thumb is unstable and it kind of drifts towards the body. We can see that on this view. It looks like it drifts a little bit towards the hand rather. And so this is a tear of the radial collateral ligament. And there's also some patchy brightness here. This is a little bone injury involving the base of the proximal phalanx. So ulnar collateral ligament intact, radial collateral ligament is torn. And this is just one more view we see here. This is the thumb in profile. We see the flexor pollicis tendon here, this dark band that is normal, it's intact. Along the back side we see a much smaller one. This is the extensor pollicis tendon, that dark line. It is not torn either, so that's intact, but we do see that there is some thickening over here. This is the dorsal joint capsule. There's a capsule around that joint, and this capsule is just strained back here. And there may be a little subtle buccal injury of the base of the thumb here. So the bright stuff here is also abnormal. This is fluid, or edema rather, in the subcutaneous soft tissues on here and here. So a nice example of a torn radial collateral ligament, and the UCL is intact.